Hello, this is Dr. Shorman of ShoreMed here in Miamisburg, Ohio. On our website, we've attempted to point you in the right direction when it comes to getting quality information about regenerative medicine therapies. As we discuss in office, regenerative medicine typically consists of either platelet-rich plasma or PRP, stem cell administration, or prolotherapy administration. Due to the commercialized nature of PRP and stem cell administration, not too hard to find information of these two things on the internet, finding quality information that may be something else. Nonetheless, there simply is not all that much information regarding prolotherapy administration. Thus, I decided to put together a bare bones video reviewing what prolotherapy is and its mechanism of action. Unfortunately, no bells and whistles, sorry. Prolotherapy or proliferative therapy has been in existence for hundreds of years at this point and was likely the original regenerative therapy. The initial concept was injecting an irritant into an injured area, typically a chronically injured area. This would recruit the body's own natural inflammatory cascade to the area, releasing growth factors in particular within the area, aiding in the regrowth of things such as cartilage, tendons, and ligaments. However, there is a secondary mechanism of action which is often not discussed. Prolotherapy is also known to desensitize nerves around a painful or injured area. As a point of education, nerves transmit signal via the release of chemicals by a number of channels throughout the length of a nerve. So from the central nervous system throughout the distance of the peripheral nervous system throughout the distance of the nerve, nerves communicate by releasing chemicals via channels. Prolotherapy, in particular dextrose prolotherapy, is noted to downregulate the number of TRPV1 channels. These channels are noted to release certain inflammatory factors, in particular the substance capsaicin, which is known to be responsible for chronic gnawing pain within an area. So a number of studies have actually shown that injecting prolotherapy, dextrose prolotherapy, adjacent to the nerve, not only at the level of the nerve, but throughout the level all the way up to the central nervous system, will downregulate these number of TRPV1 channels, thus downregulating the percentage of capsaicin, this painful substance that is released. You can imagine then, each time prolotherapy is performed, there is a smaller and smaller percentage of these channels that are remaining. Therefore, it is providing stepwise improvement with each desensitization. So as opposed to PRP or stem cell, which we expect gradual progressive improvement with gradual progressive growth of the substance, with prolotherapy, you do get regrowth, you do get the proliferation, but you also get this desensitization where we get stepwise improvement. For example, one of the most common things I treat with prolotherapy desensitization in my office is post-knee replacement pain. The great majority of individuals who have a total knee replacement do very, very well. Unfortunately, there is a small percentage of individuals who continue to have knee pain when their knee has been replaced. In that circumstance, we will offer prolotherapy desensitization to what are called the genicular nerves, the nerves primarily responsible for knee pain, adjacent to the knee. So essentially, in this circumstance, there is no knee left. There is no cartilage to cause this patient discomfort. What is left is this chronic ingrained nerve pain. So what we will do is provide genicular prolotherapy. And with this, we inject prolotherapy adjacent to the nerve, and with each procedure, stepwise improvement. So procedure 1, 30% improvement. Procedure 2, 50-60% improvement. Procedure 3, 70-80% improvement, etc. So in particular, in an example where there is no cartilage left, this gives us a good example of the expected stepwise improvement that we see with this secondary mechanism of action. So ideally, I've provided you information on exactly what prolotherapy is, its mechanism of action, and what it may be able to do for you. Ultimately, there is not one predominant regenerative therapy. Your ideal regenerative therapy may be prolotherapy, it may be platelet-rich plasma, it may be stem cell administration, depending on your specific presentation as well as your medical comorbidities. In our office, we strive to base our treatment recommendations upon Level 1 evidence, double-blinded, placebo-controlled trials. We strive to educate our patient and allow the patient to move forward and direct their management as best they see fit. As always, feel free to contact our office with questions. Here's hoping you are having a wonderful day, and here's hoping you and yours are well. Thank you.